Welcome to the Next Level podcast. I'm your host, Scott Dickinson. The following is an interview with Dr. Heather Linden. Heather is the Director of Physical Therapy at the UFC Performance Institute and former physical therapist for the United States Olympic Committee. We dissected the UFC athlete from both a physical and psychological perspective. We chronicled the UFC's medical evolution in recent years, and we explored her path, how she got to the most elite positions in sports medicine. Finally, I asked for her advice on leadership, productivity, and having a career to be proud of. Many thanks to Heather. I hope you enjoy. Heather, welcome to the podcast. This is the Next Level podcast. Thank you for joining us today.
Thanks for having me.
It's really a pleasure to talk with you. And we came into contact via social media, something that I really hated prior to this whole Next Level journey. But I have to say it's been a tremendous help for me. And, that's how we connected. That's how I've connected with many people. So I'm slowly coming around to social media. How do you feel about it?
I mean, I'm the same way. I'm definitely a little old school when it came to like social media being a huge platform for physical therapists and things like that, because, you don't necessarily know the quality of everything you get, right? We've seen on social media things that are brilliant and that have guided the general population into a lot of great health things. We've also seen patients, athletes self-diagnose themselves right now and be able to be like, oh, well, I saw this, or this guy, because he has a lot of followers, must know what they're doing, and maybe not the best, perspective for that particular injury. So I think there's a lot of pros, there's a lot of cons, but it's definitely, brought our profession together and has given us a platform to actually educate people to do self-care and to do really, health things that will, improve their longevity, reduce injuries and things like that. So it's definitely something that I think we all have to get used to, and that we, all need to be a voice on it and make sure we get the really good information out there so people can utilize it.
It's definitely not going anywhere, is it?
No, it's just expanding. We had a media platform that came in town last week. So it was like Twitter, TikTok, Instagram, and they sat down with our athletes on, how to use that for themselves, also to expand their following and make them more important on the social platforms, because, we do have a lot of our athletes that have come through that pathway of not necessarily knowing what to do with their social platforms, right? You can use it now to create income. You can use it now, to expand a lot of your following. And, our sport in the UFC is not only a sport, but also entertainment. So these guys came in and did a lot of, informative sessions with our athletes. But then one of them came down and was like, I'm going to actually hound you. Like, why aren't you doing more with your platform? Your social media is only your personal life. And I was like, I know. And I just kept shaking my head, and I realized I'm going to get together with them in the next few weeks and try to do more and educate more and use it. I just haven't done it as much as I should.
Because you have built up a significant following on at least Instagram. Do you feel like your audience, do you have a gauge on who your audience is? Is it mostly rehab professionals or someone?
No, I think it's mostly my own athletes. It's more of a personal thing. It's all the athletes I've pretty much worked with throughout my career, and then my friends and family. So I really haven't even tapped into the market, I would say, from a professional standpoint. Most of the people, it's a personal, social media platform that I have currently. And most of it's all the athletes I've worked with and, have been a part of their journeys.
So you referenced it, but you are head physical therapist for the Ultimate Fighting Championship Performance Institute, correct?
Correct. So
are there other physical therapists within the UFC, or do you outside of the Performance Institute in Shanghai and here? Are there other physical therapists, or just you?
No, there sure are. So we not only have other physical therapists in our Las Vegas facility, but we also have them in our Shanghai facility. So currently we have 4 physical therapists, including myself. We also have sports chiropractors, and we also have athletic trainers that are all a part of our team. So, the Las Vegas facility was the initial sports performance facility that was opened up, and I became the director of physical therapy there. And initially it was just myself. So I spent about 6 months in the UFC being the only medical provider besides our chief medical officer, who's an ER physician that had been in the program and had worked with UFC for, probably since they first started. So he had been there for at least 20 years when I started. So that was the foundation of an emergency room physician being basically the only avenue for athletes to talk medically. So when they hired me a little over 5 years now, we opened the facility in Las Vegas. That was the Performance Institute. And we had medicine, so sports medicine, strength and conditioning, sports psychology, sports science, nutrition, pretty much an entire performance team that you would see under any professional organization come together and, create kind of our dream performance center, which was really nice. The UFC didn't really know what to do. They had toured the Olympic Training Center, which was my background. They had toured various other professional organization centers. And pretty much with our initial 6 of us that were hired, they said, create your dream environment to work out of. So I have, I've created that with my amazing team. I could not do it without the amazing providers that are working with me every day. Like you said, physical therapists, chiros, and athletic trainers that are all working together. And we have 2 facilities now, and we're about to open a 3rd facility next year.
Is that right?
It is.
To divulge the location yet?
We've kind of talked, I think we've heard actually Dana already talk about it. So, and we had almost planned to open it up this year, but with COVID and everything like that, that kind of restricted us, but we'll be in Mexico. So our 3rd facility will be in Mexico. So we'll have, we keep expanding, and we want to make sure that our athletes have performance centers globally around the world so that they can tap into them. We also utilize our performance centers to build new athletes, that really haven't had the avenues to get into UFC. You can see for us, we've had wrestlers, football players, boxers, a lot of the Olympic combat sports filter into UFC. Other countries necessarily don't always have those avenues. So in different countries that we don't have that foundational platform, Dana's really, creative about pulling in populations, teaching them programs, jujitsu, different after school programs that children can do, and then tap into that and build them into, combat athletes.
So we are just developing the ultimate fighter worldwide.
We are, we definitely are giving them avenues that they can, be successful in combat sports. So many times we've heard, old school, it was jujitsu versus wrestling versus boxing, the different combat sports, who's the ultimate, combat athlete. But now, we're training athletes from the beginning up to be, very broad-based, knowing all the different foundational components that go into combat sports. So I think we're going to see these athletes even progress and evolve into just absolutely amazing athletes that will have great longevities and great careers like we've seen in different professional organizations.
It's so crazy how young your sport is, and to be this, UFC is like worldwide now. Everyone knows the UFC, and you were the 2nd hire within the medical staff.
Yes, I was. It was crazy, right? Like, it's crazy that literally only 5 years ago, when we were close to, I think we're almost at 28 years of being a sport right now. We're coming up on our 30-year anniversary. I was lucky to be a part of this on the 25th anniversary, where we went back to the original facility in Denver and had a big event there to symbolize that 25 years where we initially had started. And in those 25 years, right, these athletes have been independent contractors. Yes, they've tapped into medical, clinicians all over the world where they've kind of trained or needed some help, but it really was the wild, wild west. There wasn't a structured organization where, they could contact and say, hey, can you check out my x-ray? Is this a rehab, or is this something I need to do surgical? A lot of times before we opened up the Performance Institute, everybody went the surgical pathway because that's kind of, they had physicians that were overseeing it. You had possibly a torn labrum or a ligament that was torn in your knee, and you were told that, hey, you need to get this surgically operated on. Well, we now know with technology and all the, amazing things that we have as clinicians, that a lot of times maybe surgery isn't always the number one option that you have to do. We have grown so much with technology in the sports medicine, profession, that we can a lot of times, get through these aches, pains, bruises, injuries, and still be very competitive.
See, that's something to double click on that, prior to the UFC having a physical therapist on staff or bringing in the career as a whole, fighters were kind of on an island. The only people they had whispering in their ear were orthopedic surgeons, perhaps. And, that's what they do. And fair enough. But, that's a really interesting topic that you bring up. And it's something that we can broaden out to the scope of physical therapy. So that's kind of amazing. And, now it's put into practice. Like we know Francis Ngannou just fought in the UFC with a torn ACL, correct? He
had a torn ACL and MCL. So, he had both going into this world championship title fight. There was definitely weeks leading up to this. Do we pull him? Is he at 100% capacity? Will he be able to perform at his optimal function? And, we had big meetings with coaches, teammates, the whole performance team that went into it, and was able to successfully rehab and be successful in that championship. And then he was able to get the surgery afterwards, which, if he hadn't been at that moment, who knows what he would have lost out on his career.
Right. And yeah, it's a crazy thing to think about. 20 years ago, if that happened, how we would have managed that whole situation differently. Do you see it playing out the same?
I do. I mean, I think my first London Olympics, I had an athlete that in Olympic trials tore her ACL. And, she had trained her whole life to be an Olympian. So being named on the Olympic team with a torn ACL, what do you do with that athlete? We at the time took chances and were willing to rehab it as much as we could to get her to walk out there and be able to perform her sport. It was an individualized sport. She was a javelin thrower. So we were able to rehab her dynamically and be able to functionally get her to be able to throw the javelin. Was it maybe her best numbers she's ever performed? Maybe not. But she was still able to be an Olympian, and she had given up and sacrificed her whole life to walk out there and call herself an Olympian, that we were willing to do whatever we could. And I think that was the first time I started looking at injuries a little bit differently. And since then, I've always, challenged that, do we have to always go to the extreme measures when it comes to injuries? Our bodies are amazing things. They want to be healthy and fix it. They have adaptations. They have ways to optimally be functional, even when there's pieces that maybe aren't at the strongest. So I think it's pretty cool to see in the past years from my Olympic background to my UFC, how it's played out and how we've been able to manage injuries, maybe not in the most ordinary fashion that we would see a general practitioner or a general orthopedic follow. I mean, it's pretty cool. I now have an orthopedic that I work with very closely that I have sent him probably 4 or 5 ACLs in the past year and a half, where he's called me and said, I'm not sure what you're doing over there, but they don't need a surgical,
they're functionally
procedure. Like they're functionally stable. I'm having them do things that, even an athlete can't do, and they're being able to do this. I just had a few athletes fly in and I saw them privately that aren't UFC athletes that, their doctor said, oh my God, you tore your ACL, you absolutely need it. But when I functionally put them through testing, there was nothing I could do that they couldn't do. And they also did it better on their ACL side than their, non-injury side. So when you can provide an athlete with that capability, it's pretty amazing. However, I will say this, our athletes aren't sprinting, cutting, our athletes have a very different mechanism of performance. They are a more up and down. They have so many components of their sport that there's ways possibly that, this is just a successful way of being able to perform without their ACLs. I have like a weird theory that, the mechanism of our leg kicks that we see athletes do possibly do micro tears of the ACL over time. And that's why their body is able to adapt, because all of my ACL tears aren't these huge blow up tears that I saw in football, that I saw in other sports. They come in and they felt a pop, we get an MRI, it's an ACL. There's no limitation. Within 2 days, functionally, they're doing things again. And I'm like, that's not normal if it's a huge blowout tear. So maybe I think that structurally over time with these leg kicks, which their leg kick mechanism is extending and rotating, which is an ACL mechanism, that over time, these micro tears just happen, their bodies adapt, and then you see them completely functional afterwards.
That's interesting. So are you saying it could be on the stance leg or the kicking leg? And I mean, obviously they train both, and over time, the ligament sees enough stress, it builds itself up and gets stronger.
Well, so not necessarily get stronger is if they have these small micro tears where small micro tear, the body adapts, small micro tear, the body adapts. And then they get that final pop that they hear. When they hear that, that's usually when they go in for diagnostics. But usually when I ask their past medical history, they're like, actually, there was this one time where my knee shifted a little, or there was this one kick I did. So, for me, I think the body has learned, to get stronger from a hamstring quad ratio. And then once they get that final pop, they don't get this huge swelling because there's been micro tears over time and their body's muscles have adapted, or the other ligaments have adapted in order to have a very stable knee. So that's kind of my theory on it. And, I've talked with a few docs, and my one ortho surgeon is like, I can tell you structurally, the ones you send me where you say, I don't think they need it, you've been spot on. And to have an orthopedic surgeon actually say that to you, right? To an orthopedic surgeon to say, I think they can hold off, because if you think about it, the longevity of our athletes, is definitely expanding because of recovery and tools that we're able to use. But at the same time, they could be on the rise to the title fight, and you take them out, 9 months to a year for an ACL, that might change all the rankings in their favor or maybe against them.
Yes. So, and that kind of connects me with remember Tristan Connelly?
Yep.
He was kind of the fighter that put us together, and how we've connected more since. Tristan has an interesting story. Well, do you want to tell Tristan's surgical history?
Yeah. So Tristan, he's been very open about his surgical history with having 2 levels of an artificial disc. Tristan first came to us with, a lot of the radicular symptoms that he was getting down his extremity. By doing diagnostics, you could see he had a really bad disc herniation, and he initially went in for the first I think he was our first, if not our second athlete to have an artificial disc. He then over time also had, some degenerations and things going on with another level, and opted, after having radicular symptoms again, getting a second artificial disc. So he is now our first athlete to have 2 artificial discs and compete. So, athletes aren't sure, but we're seeing with the technology and the growing of that. Right now, I have multiple athletes. I mean, we also know Aljamain Sterling. He's a world champion. He has an artificial disc, right? So we know that these athletes, and it's not like these athletes are competing lightly. It's not like they're not getting their head pulled on, grappling wise, wrestling wise, taken down, possibly punched in the head. So there's a lot of forces and motion that are going on. And we're doing a lot of studying here at the Performance Institute to understand exactly what are the forces, what is the best means of, your deep neck extensors versus your flexors in order to have a really stable head. Can it reduce concussions? How does it reduce concussions? And we're doing a lot of research on all of that with these athletes in order to, best be able to suit them and maybe not only prevent things in the future, but then know if we do need something like an artificial disc, how to rehab them back correctly.
When you say studies, like what kind of structure do you guys use? Is this all internal, or like do you let researchers from universities come in and study your athletes? How's it work?
So one big thing about the Performance Institute that you will know is completely different than other organizations is everything we do is a sharing of information. So we are collaborating with different schools. We're collaborating with different technology, whether it's mouth guards that show us the force or the accelerometry. We're looking at strength testing. We do a lot of force frame testing. So a lot of ratios of muscle, flexors, extensors, quads, hamstrings, things like that when we're doing all of our rehabs and with our strength and conditioning. So our strength and conditioning team is pulling numbers left and right. Okay, neck injuries seem to be something that we chronically see in the sports medicine clinic. So strength and conditioning are even doing parameters before they get injured to see what their necks look like, right? A lot of times in medicine, we always go down the one avenue, but we don't have the full story. Like for instance, I had Olympic swimmers that we used MSK ultrasound to check their shoulders. We knew there was a lot of degeneration, labrum issues, rotator cuff tears, on the whole team before they even had symptoms. So when the athlete came in with symptoms, when we got diagnostics, the doctor's like, oh, labrum tear, needs to get surgery. Well, we go, actually, the labrum has looked this way under MSK ultrasound its entire life. Look at the bicep tendon. It's actually showing inflammation, which they did not have that previously when they were pain-free. So we then treated the bicep tendon. The athlete was able to make the Olympic team and medal in the Olympics, where that doctor would have done surgery initially, and then that athlete would have missed that Olympic opportunity. So we're taking that same model here at the Performance Institute and really trying to get technology to look at prevention. What is actually happening to their necks? Is it a weakness? Is it posture? Is it just a particular incident that we couldn't have prevented? But we're trying to take all the information we can get, collaborate together as a performance team, and understand, how these injuries are occurring and how to keep these athletes healthy.
As a neck guy myself, can you tell us what you guys have learned about when you study the characteristics of the cervical spine, flexors, extensors, injuries?
So we actually, on my team, we just had a presentation done by my team in Shanghai, because the nice thing about Shanghai is they're able to collect information on developmental guys. So before they've had the wear and tear of being in the UFC and have multiple, fights on their, and what we looked at is looking at the ratios between the extensors and flexors. So we use force frame in order to do all of our isometric and stuff testing. And what we've done is we've created kind of a platform of testing in supine and prone positions, the neck, flexion, extension, lateral side bending, all rotation, everything like that. We put that and compiled that together into almost, we call it like a neck profile of the athletes. And we're now going to unroll that into the amateurs that we see versus kind of our professional athletes and see if we see a big difference between each neck. We're also then going to take in, so this is kind of what we just started. Literally, we had a meeting on this last week of how to better understand the neck mechanics of our athletes. Because initially when we did all of our force frame testing, we tested in quadruped. And then we found that there was a big discrepancy in how, shoulder girth, other muscles that they were recruiting. So we revamped it. And then now we're doing all of our testing in prone. And we've seen the numbers really clarify and have a standard. We're also looking at to see, is it heavy weight, versus, more of those flyweights? How does the smaller division neck compared to the bigger guys, right? Because we see more knockouts in that bigger population and more power and things like that. Is there a standard across all the weight classes to understand exactly what's going on to that? Because I mean, there's so many theories on that. We look at our sport and you'll have people say, oh my God, that's a lot of torque on a neck, a lot of forces that are being, across the board. But, our athletes have the standard fighter pose, right? They seem to be super hypertonic. They seem to be, you have your SCM and your scalenes, you have your pecs, you have all those anterior neck muscles that seem to be way stronger than the small, cervicus, your multifidi, all of the back muscles. So we're trying to see if we change that with their S&C, because, an athlete at this caliber doesn't want to go do 700 rehab exercises at the end of their day, right? We know this. We have to figure out, where do we put in that? So one thing we're doing is using like NecksLevel, using different products for cervical strengthening into their warm up for their strength and conditioning, because they're going to do a warm up no matter what, right? So let's take 2 or 3 of the top exercises due to their profile. And that's the other thing that we've really changed with our strength and conditioning platform as well, is making it super individualized. So this guy might come in and he might be really weak when it comes to lateral flexion and rotation. Why is he doing the same warm up as this guy that's really weak when it comes to, deep extensors? It needs to be completely individualized. There needs to be objective information that guides those warm-ups as well as then, into prevention.
Just because I'm so curious.
Talking a lot.
I'm just so curious because I know there's a NecksLevel there. Can you speak at all about how it's being used? And is it a strength and conditioning tool? Is it a rehab tool? Both?
So it's both, actually. We're using NecksLevel a ton with our cervical rehabs because it's a very smart tool in the sense of the motion is in really good form. You can get great motion, good quality of motion on top of adding strength. So one thing, we see a lot of our athletes do, I'm trying to remember what the name is, the helmet that they're wearing and they're doing the neck strengthening. I forgot. Yes, the iron neck. Thank you. we see a lot of athletes doing that kind of stuff, which, that's a great mentality of, yes, you need to strengthen and stabilize. But if you're doing it with your neck out here, your shoulders rounded forward, and you're just cranking on one, you're not getting the rotational component at the levels you're supposed to, right? Let's go back to anatomy and physiology. So we need to make sure that when the athletes are even doing the iron neck, they're starting on something like NecksLevel, right? They're starting where we can ensure that the position of the neck is in the exact right position as they're strengthening those little muscles to fire. Then we can go into something more extreme like an iron neck or other forms that we could do, isometric, kinetic, things like that. But we need to make sure their foundational components are key. And that's where we are using NecksLevel. We're using NecksLevel for that. And then we're transitioning into it with strength and conditioning, where they can add, doing a strength and conditioning, a dead bug, or different exercises, why they then use that and get that clear motion foundationally. Because we also see in athletes, they might perform something really well in a static position. The minute you take them out of that and they're moving and they have to integrate other muscles, they might lose that really good foundation. So we're able to kind of transition and use NecksLevel in that form.
That's great to hear. That's awesome to hear. Can you speak about, because I get asked a lot of questions about, oh, will this help prevent concussions? Do you feel like this has a role in whiplash prevention? And for the UFC, almost every fight probably involves some level of concussion or whiplash. Can you speak about your thoughts on neck strength as it relates to whiplash, concussion, head acceleration?
So right now, everything we've done so far testing wise, there's a huge component that neck strength plays when it comes to minimizing concussions, minimizing the acceleration of what's happening at the brain. We're also just now kind of tapping into some craniosacral work and things like that to also incorporate. Like some of the things I've seen with the athletes recently is like, I will correct the symptoms. I will improve the strength, use NecksLevel for that. And then there's like, they kind of come back with a few other symptoms. So then I pull them into more craniosacral work, working the jaw, working all the different sutures of the skull, because that's a whole component that we also need to look at, right? So not only do we need to look at neck foundationally, posture exercises, but we also need to look at the cranium and the sacrum. And one of the things, the courses that I've been taking is looking at, even falling on your rear, you can pull the spine and create a whiplash, which you're also going to see with our athletes as well. So we're trying to pull in all of those components, but the for sure thing we are seeing is that there's definitely a correlation with neck strength and concussion and whiplash happening. So we've definitely noticed that, the more foundationally strong necks seem to get less of that, but we're actually making sure, one of the things we're going to do this year, because like you said, you would think after a fight, a lot of our athletes would come in with different concussion symptoms. It's actually shocking to see how many don't. We've had, so one of the things that I did have an athlete once come in that had a really brutal knockout, and I was for sure that this athlete, had a concussion. We tested she had no symptoms at all. So I was like, okay, she's completely asymptomatic. But the one thing I did notice is her reaction time was a little bit off. So when we did neurocognitive testing and had a comparison to her baseline, we could see reaction was off. And that wouldn't be something that you might not train, right? She's asymptomatic. But to me, that is obviously another form of concussion, having that part of her brain. So we did isolated exercises to make sure reaction time. We used synaptic and we used different reaction exercises in order to bring that back and then make sure her baseline and her new testing scores were equal. So we can use it on a lot of cool things like that, which you might not see. A lot of these athletes come in completely asymptomatic after that, but thankfully, we are having a lot of baseline information and things to refer to so we can actually isolate what type of concussion do they have, right? Is it more what part of the brain is, inflamed, or what part of the brain maybe got injured during that fight? So we're trying to isolate the exact amount, correct that, go back to the neck strengthening, and then return them back to sport really gradually.
It's a beautiful process. Now, when people make it all the way to the UFC, it would blow my mind that not everyone has this gargantuan, strong neck across all planes, and because there's so much involved with the neck in fighting, grappling, jiu-jitsu.
Yep.
Do you feel like there are athletes that come in with this beautiful neck profile, and then others where you're like, how are you still in the fighting world? Like what is the how does it run across the gamut?
100%. I mean, but we have that. That's the beauty of MMA, right? You have people that are like, I mean, the best athlete that you've ever met. They can do all aspects of MMA and combat sports. And then you have somebody that comes in that can't even jog right, can't even. So, you have, and that person walks in there and knocks the other person out. So, even now, because the sport is so new, we don't know what makes the perfect MMA athlete, right? Because you have those wild, wild west people that might not have a strong neck, might not have the physicality of another athlete when we've done testing, but sure as heck goes in there and performs at the optimal level and can't be stopped, right? So we're still learning, what exactly makes them. Is it something more from a sports psych standpoint? I can say this, we've had multiple athletes retire recently. All of those athletes, personally getting to know them, there was something that switched with them, that, that fight or flight wasn't there, that, and when that is not there in this sport, this is probably the one sport you can't fake. You can't go out on a field and catch something or go hit a ball when you're having an off day. I mean, this is literally the utmost athleticism, getting locked in an octagon when you have to out strength, out power, out dynamic, out everything your opponent, right? So there's nothing like it. That's why the sport has evolved, and that's why the sport is so popular.
Shout out to Donald the Cowboy Cerrone, am I right?
Yeah, always. Honestly, he's an amazing human being, and I'm super excited to see what's next for him.
So you've gotten the chance to meet so many professional fighters now, and Olympians for that matter. So I had built up this stereotype in my head before I started working and talking with UFC fighters or people in the MMA crowd in general. They would be scary, they wouldn't be nice, and they would be like intimidating and probably didn't want to talk to me. I couldn't have been more wrong.
Not true.
I've been so pleased and happy that like people like Tristan and other UFC fighters I've gotten to speak with are one extremely humble, right? I think something about the sport makes them humble because they know that at any moment they could go the other way and their career could be over, whatever. Their humility, and then they're always kind and they're willing to help you out. Did you come into the UFC because you haven't always been in this specific facet? Like, what kind of stereotypes have been challenged in your head, and probably when you talk about your job to others?
So I guess when I first started, I was a little bit intimidated. I wasn't sure exactly what this professional athlete looked like from a personality standpoint, from a training standpoint, from an injury standpoint. But like you said, I've been so surprised about this athlete population. Is one of the most humble, one of the nicest individuals. They realize that, their sport could be short-lived, their sport could be, and I think, one thing that they've all said to me, I literally was talking to an athlete this week that was in here for International Fight Week. And she said to me, I sat there and signed every person that was in line, at the expo. And there was this person that, was in a wheelchair, and I could see their significant other trying to take a picture from this stage. And she was like, heck no, I walked down there, went to the front of the line, made sure that they got a picture in person. That just tells you about these people. I've so many times walked around with Forrest Griffin because he is not only my teammate at the performances too, but / boss of mine. And he will sit and stop and take 500 photos with fans. And every single one of my athletes has said, if it wasn't for them, I wouldn't be where I am now. These athletes don't come from a college pee-wee environment filtered into professional organizations, right? These athletes come from possibly a traumatic injury or never had anything, or, got picked on, or, had to, really fight for themselves. So that's something that I can say is very humbling. I also laugh, and, I always say there's those people in the world that you're like, man, he needs a good punch in the face, because they are not a nice person. And these guys do it for a living. So the minute they step out of that octagon, they're like, I get paid for that. I don't need to be a jerk to other people. I need to, realize, and they're just so nice. They're the first people, if I have a long day, Heather, can I bring you lunch? Can I bring you a coffee? If I'm on the fight card and I'm working a 14 to 16 hour day, I will tell you those athletes, at least 95% of them have asked if I need something that day, which is pretty incredible when it comes to the pinnacle of sport, right?
That's a beautiful thing.
It is.
Can you rewind for me and talk about how you got your position first with the Olympic team and then secondly with the UFC? Because there's hopefully a lot of physical therapists that are going to listen to this and probably want a job or a career similar to yours. So can you talk about the mechanics of what you did to get where you are?
So, I mean, honestly, this is going to date me because I guess I've been practicing for 17 years now, and which is crazy to me. I always thought when you had 10 years experience, you were old, right? But I'm going to say that I'm not old.
You're not old.
At least young at heart. But I will say this, it was really tough. You didn't see physical therapists in a lot of the sporting organizations. It was mostly athletic trainers that you saw behind the professional sports. My mom messaged me one day and said, the Olympic Training Center takes volunteers for 2-week clinical rotations if you are a licensed medical provider. At the time, you had to have 5 experience. I think they changed that to 3, but I'm not sure exactly what they do now. But you could go volunteer your time, work with them collaboratively, and just get to really, get your foot in the door when it comes to professional sports, because each Olympic sport has, their NGB. So USA swimming, USA track and field. And those, different NGBs are constantly traveling the world and needing national governing body.
Oh.
So, like you have, let's say 52 sports at the Olympics, then you have each one individualized, right? And each one has, kind of feeder programs that then go into, being an Olympian. And those people are constantly traveling for international World Cups, international competitions, and they need medical providers to travel and be available for them. So that's a lot of people. If you have 52 sports, that's like 52 teams needing support from medicine, right? So you can volunteer and become one of those clinicians, whether you go directly to a national governing body or whether you volunteer at the hubs, which are like the Colorado Springs facility, the Lake Placid facility, or the Chula Vista facility. So that was my pathway. I initially knew I wanted to do sports. I put my head down and became a dork and did a ton of continuing ed so that I really upped my manual skills and my diagnostic skills. And then I applied for that volunteer position. I ended up getting accepted into that volunteer position. So I went to Colorado Springs for a 2-week free, non-paid internship, pretty much. After being there for a week, they asked if I could stay after on a Saturday and talk with one of the heads of that department. So I stayed, and initially I think, the worst thing possible, like, did I do a bad job? Was there something I said to an athlete? What did I do? But fortunately for me, the head said, I'm watching you work all week. Athletes are coming to me and saying, how to do everything. Like your manual skills are on par. They would love for you to travel with them. So if athletes are giving us good feedback and the other staff members are really able to work with you collaboratively without an ego, without this, we'd like for you to consider a position that we have open currently that we have not filled. So I literally got out of there, called my mom and was like, oh my gosh, I think I need to take this position. Even though at the time I was about to open up my own outpatient orthopedic clinic in Southern California with my best friend. We were going to do Pilates, women's health, sports, things like that. And I literally just put that on hold to pursue my dream. So I ended up getting pushed into the interview process. And then luckily for me, came out on top on the interview process and was able to secure that job with the Olympic Training Center. And I worked there for 6.5 years. I did London Olympics, Sochi Olympics, Rio Olympics. I was the medical director for the Youth Winter Olympics. I did Pan Am Games, Para-Pan Am Games, kind of everything you could imagine. I got to travel the world. Definitely my love for travel on top of doing physical therapy was able to be combined. And, I did that 6.5 years. And then one day I got a call from a recruiter, and the recruiter said, we're opening up this performance institute at the UFC. We'd like to talk to you. And I said, I don't really know anything about UFC. I know like my wrestlers might, buy a pay-per-view and watch it because one of our friends from wrestling, is now in UFC or something like that, but I didn't know much about it. And they just kind of chuckled because they're like, a lot about it, but you don't know about it, which we actually kind of love. You don't care who's the who. You don't care who Conor McGregor is. You don't care who ego wise these people are, but realize, we have grapplers, which match your wrestlers. We have strikers, which match your boxers. We have jujitsu. We have taekwondo that are going to be all the Muay Thai stuff, and everything that I had learned foundationally over the 6.5 years really filtered into UFC so seamlessly. It made my job very easy because they were completely correct. An athlete would come in and say, "Oh, I have," and I was like, "Oh, you have," and they're like, "How do you know this?" And I'm like, "Yeah, I've been dealing with this for 7 years with combat, athletes, and I feel pretty comfortable treating combat athletes." So it's definitely been a positive. I've been very lucky with my journey that things, have really played out, but, I've just put my head down and worked really hard, constantly learning, realizing that, you never know anything in the scheme of things, right? There's always people out there to learn from. There's always things you can learn. And I just keep challenging myself and hoping, that this keeps going.
So we have Mama Linden to thank for this, huh?
We do have Mama Linden. I mean, Mama Linden was like, "If you do this volunteer, you'll go to the Olympics." And I was like, "Sure, Mom." And I did. I literally did. So mothers are always right. You might not want to listen to them when you're young, but they always have very good intuition.
And you had a willingness to work for free, which, I think is so important these days. And clearly I work for free for NecksLevel to get this thing off the ground. Like, no one's paying me. And it's just what you have to do. You got to put in your time. And
you do.
I think it's a beautiful
And
message.
like, I hate to say that, but new grads, like if you take anything from it, and there's no expectations, right? Like you put your time in. We've all been there. We've all had to put our time in there. And like, that's honestly the only reason I'm sitting where I am today. It's not because I didn't have the connection. I didn't have the person to call to give me in the door here. Everything I did was working hard to get where I was. So I think that's a really important message is for new people, because I do get students, and the students that I love and the students that I would hire in a second on my team are the ones that don't have the egos and don't look at sports like, "Oh my God, I got to get a picture with this guy. And it's about me posting this guy and this guy." It's literally just fixing people, keeping them healthy, looking at it as this body's this different than this body, and let me figure out what this puzzle is that I need. And that's really important, I think, in today's world.
So you've built up a team underneath you now, and as hopefully a future leader myself, can you provide me any like leadership skills or advice that you have learned over your time?
So I can tell you this, I would like to say I'm a good physical therapist clinically. Leadership has been by far the hardest thing that I've struggled with. And I will say I've had to realize that you are only as good as your team, right? When you first get in sports, and I can say I'm 100% guilty of this, is you want to be the person that athletes always go to because you're good and you know your stuff, right? But realize there's hundreds and thousands of athletes out there. You can't see them all. So build up the people underneath you in order to be successful. You're only as strong as your weakest person. I've had to realize, put that ego aside because I can't see every athlete. So I want my team to be equally as getting the feedback and getting, all the hard work and the notice and everything like that, because I would be nothing without them, right? Like they are such a great team to work under. I have learned how to be a better boss. I've taken a lot of leadership courses on my own, as well as Endeavor and UFC offer a lot of leadership. But it's really just I've also been mentored by a high level exec that, works with me every 2 weeks to talk about how to handle things. Because initially I was very, like, come on, if I came back from a trip and let's say this was at the Olympics or here, and this rehab that I was working with wasn't on par, I was the first person to be like, "What are you guys doing? Come on now." Like now I've realized it's not about that. I'm like, okay, what are we missing as a team? Like, let's talk about this, and realize that it's also, athletes are very smart too. An athlete can see one of my clinicians for a rehab and say, "Oh, well, this person said this, I want to do this," and like play it, right? So you have to build that foundation of your team and have that unity and have each other's back, and also realize to grow. So one of the coolest things we do here is each one of us kind of has our specialty, right? Like Dr. Tara, she's our chiropractor. Dr. Ryan's another PT. Bobby Gaisford, he's an athletic trainer. We're all taught slightly different. So like Bobby teaches us once a month, we have Bobby teach us something that he's better at, like whether it's strapping, taping, emergency care, bracing, something that like he was. Tara has taught us, in PT school, we're possibly only taught one way of adjustments. And chiropractic school, they're taught 15. So Tara has taught me as a little female how to adjust these big guys so much easier. Ryan came in as he was a student of mine. Then he worked for the Houston Texans, and he's like, oh, this really works from a rehab standpoint, or, from a sports organization wise. So realizing that, we also learn from our students. We do clinical rotations with students here, and they'll come in and be like, hey, what about this? And I'm like, oh my gosh, I didn't even know that when I was in school. Like, teach us. So it's, being able, I think you're a good leader and a good boss if you foster a really good environment for your team to continuously learn and to continuously, be each other's cheerleader, be each other's, person that drives them to be better and keep evolving. Otherwise, I think you get placid and you necessarily don't keep growing and having that journey. And it's nice to have that journey with people that, are very important to you, that you like working with every day.
To be able to table the ego when someone wants to come and see you and divvy it off to someone else, like in my position, like maybe I have a PT student or, my physical orthopedic mentor or mentee underneath me. And, I have a patient who's like, oh, they've worked with me in the past. There's that resistance and the ego is like, oh yes, this is going to feel good because I'm the man. But yeah, it's really interesting to hear you talk about that and how it's important to hand off that position and build up the team underneath you. So I thought that was very well said. You're someone that does a lot and they get a lot done throughout the day. I can tell you have a lot of energy. As someone who's trying to be maximally productive in my life, can you provide any suggestions, tips, tricks, things that help you be productive, daily habits, routines, anything like that has worked for you?
Yeah. So I would say first and foremost is you also have to take care of you, right? So we get, spiraled down into long days and work days and things like that. So one thing I do not only with myself, but also my team is, for me, getting up in the morning and having a really good workout and starting my day off right is something that, I've always really enjoyed. Not only when I'm here in Las Vegas, but also when I'm traveling the world, I've been able to get up and go for a run and see a city. I might not be able to see that city once my day job happens because there could be injury, or things I need to work on. So, I make that time for myself in the morning. I've also realized I need to hold my team to that. So recently I've made them do a monthly goal, and one's personal, one's professional. So the personal by one of my teamworks was like, hey, I want to work out 3 mornings. I have a newborn and I need this and I want to do this. Another one's like, I want to read a book, so really having those personal and professional goals, I think are standard. And I think that's really key. And then I think organization is key. I walk around old school, not with my phone, but a huge calendar of the things I want to achieve that day, the things for the week I need to achieve, and then what I need to do with my team. And really laying out and being organized also helps me succeed with not only for my athletes and keeping track of all the injuries and what's going on, but also personally, the things I need to get done that day. We also, as a team, meet like several times a week to go over cases. Hey, are these cases where they need to be so that no one's getting left behind? We have a Monday morning meeting with our entire performance team where we discuss every case that we are even talking to make sure they're doing well. And then I have a medical team meeting on that Monday to say, hey, is there things that we're not doing the best to our ability? And we constantly challenge each other in that sense. So, personal goals, personal growth, also adding that into professional and keeping that organized has really helped me be able to do a million tasks at once.
So someone very close to me would kill me if I don't ask. As a female in your position, someone who works with probably predominantly male sports, right? The UFC is probably predominantly male. What advice do you have to females looking to enter perhaps male professional sports?
Yeah. So it's actually funny you said that because my last student was a female, and my last student we've started an interview process with students, and I interviewed probably 8 guys for that position and 2 females for that position. Now, the reason I chose the female is because the female literally was like, I'm in here to learn and know everything. Like, I want to soak it all up from all of you guys, you know, your chiropractors, your PTs, your athletic trainers, and the eagerness and the excitement to learn was what made her get the position, where all the males were like, I know UFC, I've seen this athlete before, and just name drop in. And I was like, you're a fan. I would never hire a fan to work under a professional organization. So I would say, as a female, like, all you need to do is make sure you're the best candidate. People always say, like, oh, how did you get that job, Heather? But I just soaked up everything I learned, kept an open mind, dropped the ego, and made sure that I was the best candidate for that position. You know, and I think that's, sometimes we want to say male, female, but really, if you're the best candidate, you're going to get the position. So set yourself up for success, you know, as a female. And also, as a female, I would say, you know, maybe you have to do some volunteer stuff. Maybe you need to, you know, find somebody to be mentored underneath, or find somebody that like can help you with that. But in the end, hard work, making sure that you're the best candidate, and then also setting yourself up to, you know, have the best candidacy, I think is really key when it comes to the female male thing.
Heather, that was awesome. Thank you so much for your time. And,
you're welcome.
For people who are looking to connect with you, where can they find you?
So all my social media is my first and last name, which is Heather Linden, which is pretty simple. I promise that in the next month or so, I will start some professional social media stuff that I can really get out there. That's definitely one of my goals. But I would say, you know, I'm always willing to talk with students and stuff. So feel free to message me. I'm not always the best at messaging back. There's a lot of emails and a lot of stuff I get. So I always say, do it once or do it twice if I don't message you, because a lot of times it gets slipped underneath on my LinkedIn, or somebody, you know, I had a student recently like, hey, I'd love to get some information about how you got where you are on Instagram. And I saw it, but then it got like a month later. I was like, oh my gosh, I'm so sorry. So feel free to reach out to me multiple times. All my social platforms are Heather Linden. And then if there's anything I can do, I also have an email of hlinden@ufc.com. So I always try to respond to that if I can.
That's very kind of you. And I hopefully people take you up on that. So thank you for your time, Heather.
Thanks for having me. This was so fun. So I hope everyone enjoyed it. And if there's anything else I can answer, please don't hesitate.